What's up, everyone? Welcome back to the Daily Sean. My name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably won't change. Today we're going to talk about memorable moments. Today's memorable moment is my most memorable GI bleed. For those of you who are brand new to this profession, for those of you who are just getting your feet wet, who are green behind the ears, whether a new nurse or a nursing student, you have yet to enjoy the pleasure of a GI bleed. Let me say good luck to you. GI bleeds are one of those evil requirements that every nurse has to experience at one point in their career, if not more. Some of us have had their fill with this experience. Taking care of a lot of GI bleeds in my career, a lot. But there's just this one time that just sticks out in the back of my brain, just jumps off during story time when nurses are telling their stories. When the GI bleed topic comes up, I feel the need to share this one. I was a brand new ICU nurse, not even off the orientation for 6 months, was working the night shift, had a patient who had a history of dementia, came in with acute GI bleed, in the ICU being monitored, getting blood, slightly unstable, mostly was in ICU for close observation. With the dementia, patient had some cardiac history, need to be in the ICU for monitoring, mild hemodynamic instability, continuous lower GI bleeding, scheduled for a procedure the next day once we had stabilized this patient, on the night shift, giving blood, history of dementia, sundowners was in full effect. After the craziness had calmed down, the patient was tucked into their bed, could not remember to ring the call bell because of their baseline mental status. Didn't know basically what was going on at any time. Always needing reoriented. Had finally calmed the patient down. The patient had finally fallen asleep. The unit was finally quieter than normal. Middle of the night in the ICU, you try and minimize the amount of noise. Patient is finally sound asleep. Thought I was doing the right thing by partially closing the door to try and minimize the noise. Thought I was doing the right thing. An extended amount of time had passed, and I thought to myself, wow, this patient must be finally exhausted, must have finally caught the Z's they need. They're gonna feel like $1,000,000 in the morning. Don't know at what point the red flag went up in the back of my head. Thought to myself, hey nurse, maybe you should go check on your demented GI bleeder. Not a whole lot of noise has been coming from that room, and while that might be a good thing, let's just check to be sure that there's nothing bad going on. Because this is the ICU. Maybe it was an hour. I don't know. Quite honestly, I don't remember. I was just happy that for once the patient was not screaming, yelling, getting out of bed, pulling off leads, wasn't trying to rip and break something, and they also weren't shitting the bed nonstop. So maybe I was a little exhausted. Finally go back into the patient's room, and I find the patient standing at the side of the bed. Now, both the side rail had been up, it had not been down. Both side rails were up. Patient was out of the bed, and they were standing in a large pool of GI bleed remnants all over the floor. It had looked like somebody decided to start a paint job down in the middle of the night on the floor. This was in the dark because the patient was out of the bed and at the bedside. They were on certain drip, getting transfusions, fluids, and they had other medications infusing. Thought I might turn on the light to make sure that I wasn't missing anything. Lo and behold, the patient is standing in a very large pool of blood. And when I turned on the lights, it was like the scene from Daddy Daycare. Has anyone seen that? If you haven't seen that scene, you need to go look it up. You really need to go look it up. Basically, the scene in Daddy Daycare is a child went potty, and when they went potty, they did number 2, and they missed the potty completely. Instead, they decided to spray paint the entire stall. Poo was everywhere except where it needed to be. This was the scene that I, as the new ICU nurse, had encountered. Patient out of bed, GI bleed on the floor, GI bleed is everywhere else. GI bleed in the bed, GI bleed on the bed rails, the headboard, inside the crevices of the bed frame. Underneath the bed, there was blood on the IV pole, the pole itself, the wheels on the pole, the apparatus that's on the bottom of the pole. Yep, there was blood there too. Blood on the top of the IV pole, on the little hanging apparatus that the medication hangs on, the bag of medication on the IV tubing from the bag to the machine, and on the tubing from the machine to the patient. Blood inside the IV machine. Wait, I'm not done. There was more. Blood all over the patient, in their hair, their glasses, on their face, the neck, the arm. It was all over the gown, all over the legs, the feet. It was in the fingernails. It was under the fingernails. There wasn't a place that there wasn't blood. It was like a bomb went off. Thankfully, the patient was fine. The patient was there normal confused. Reoriented them for the next 5 minutes until they were confused again. Put them back in the bed, and proceeded to sterilize the room from top to bottom. As we all know, demented and confused patients are so patient and so cooperative. They lie very still while you clean them. They lie very still and sit pretty while you clean their bed. Yes, I spent the better part of my morning cleaning and cleaning and cleaning and cleaning up blood. And just as I had cleaned up all of the blood, what do you think happened? They went again. Thus answers the question of why I tell this GI bleed story. Please, by all means, do you have one that's worse? I would like to unburden myself of being the champ of GI bleeds. What'd you think? What about your most memorable GI bleed story? I'd love to hear it. Always love a thumbs up. Did you like it? Did you hate it? Good? Bad? Great? Did it suck? I want to hear from you. Share this with somebody. And as always, check your own pulse first.